So everybody, can you see the PowerPoint?
Yes, ma'am.
Okay, so today's topic is inebriants, okay, or alcohol. So there are two types of alcohol. One is the ethyl and the next one is methyl alcohol. Okay. So ethyl alcohol it is transparent, colorless, volatile liquid and has aromatic odor and burning taste. And it is the third most common drug of abuse after caffeine and nicotine. Okay. And the absolute alcohol composition of the absolute alcohol is 99.95% of ethyl alcohol, rectified spirit 90%, and next one is methylated, or this one is also called denatured spirit. So it is a composition of 95% of ethyl alcohol and 5% of methyl alcohol.
Rumi भनेर धवलाको हमला धवलाको हमला यो मिस्टर धवला वायर ओ प्रकृति ढकाल के भयो खै बोला न बोला कसैलाई
Wait, Chris, what?
के भन्छ खोला न खोला न Siskasta, maintain your silence in the class, please. अभी के अभी पहले टिकट काटा रहा
Amma mukrar kyo para.
Oh, hello? Hi. Again, so I was disconnected in whole class. Oh, everybody.
Yes, ma'am.
Okay. Just wait. We still have 45 minutes. So can you see PowerPoint now? Can you see the PowerPoint? I think we're here. Can you see the PowerPoint, Sabajana? Everybody?
Yes, ma'am.
Okay. So, okay. So there are two types of alcohol. One is the ethyl and the next one is methyl alcohol. Okay. And ethyl alcohol. So it is transparent, colorless, volatile liquid and has aromatic odor and bonding taste. And it is third most common drug of abuse after caffeine and nicotine. Okay. And the next one, composition of absolute alcohol. It composed of 99.95% of ethyl alcohol, rectified spirit 90%, and methylated, or this is also called denatured spirit. So it is a composition of 95% of ethyl alcohol and then 5% of methyl alcohol. So remember the composition. And the percentage of alcohol that is seen in different beverages. So rum consists of 50 to 60%, vodka 60 to 65, whiskey, gin, brandy 40 to 45, wine 10 to 50%, beer 4 to 10, and port 20%. Okay, you may get this one in MCQ. Absorption. So rapidly absorbs in gastrointestinal tract, 20% in stomach and remaining 80% in small intestine. Okay, and metabolism, 90% will metabolize in liver and the remaining 10% will get excreted. So you can see on the PowerPoint, these are the three steps of mechanism of action of ethyl alcohol. So the first step, ethanol will be converted into acetaldehyde in the presence of alcohol dehydrogenase enzyme. That is the first step. Second step, acetaldehyde will be converted into acetic acid in the presence of aldehyde dehydrogenase enzyme. Second step. And the third, last one is acetic acid will enter into the Krebs cycle where it is dissociated into water and carbon dioxide. So remember the step, three step of mechanism of action of ethanol. So the excretion 5% excreted in the breath and around 5% in urine, and the negligible amounts of the alcohol will be excreted in sweat, saliva, milk, tear and feces. Fatal dose of the absolute alcohol is 150 to 200 ml and the period is 12 to 24 hours. Acute alcohol poisoning consists of three stages. So the first stage is excitation stage, second is incoordination stage, and the last one is coma stage. So stage of excitation or excitement. So the alcohol blood concentration is 50 to 150 mg, and the symptoms that we see in this stage are feeling of well-being and pleasure, euphoric talk, the person often laughs and smiles. The person becomes easily angry, there is lack of control, and the person will disclose his secret or his friend secrets in this stage. Face appear flushed, eyes red, pupils become dilated, pulse become rapid, and there is a smell of alcohol in breath. And usually in this stage, the person is fit to drive. Stage of incoordination. So the alcohol blood concentration is 150 to 250 mg, and the symptoms that we see in this stage includes incoordination of speech, action, thoughts, and gait. There will be presence of mental confusion, memory gets impaired, speech becomes slurred, pupils become dilated, vision becomes blurred, dryness of mouth, giddiness, nausea, vomiting, hiccups. The person becomes easily irritable and quarrelsome. And there is presence of smell of alcohol in breath. And from medical legal point of view, this stage of incoordination is very important because most of the road traffic accidents occurs in this stage. Stage of coma. So the blood alcohol concentration is 250 to 300 mg, and the symptoms includes the person will be in deep sleep, respond to only strong stimuli, speech become thick and slurred, dryness of mouth, pulse become rapid, temperature subnormal, and the person is unable to stand or walk. And there is presence of lateral nystagmus and pupils become constricted. And we can see Mac event sign in this stage. So when you slap or pinch the person in this stage, the people that was in constricted nature will gets dilated and slowly return back to constricted stage. That is called McEwen sign. Okay, constricted pupil becomes dilated and again goes back to the constricted state. So treatment first is maintain airway, breathing and circulation, and the second one is stomach wash should be done, and then next one is we should use the composition of 1 liter of normal saline, 10% of glucose, 100 mg of thiamine and 15 units of insulin. And the last step is in severe hemodialysis should be done. So these are some of the lab tests that is done to determine alcohol in blood. So the first one is cavity test, second Kozeka and Hin test, and third one is gas chromatography. So among these three, third one, gas chromatography is most reliable. Chronic alcohol. So chronic alcohol means consumption of alcohol for longer period of time. And once the person is stop drinking, he or she will develop withdrawal symptoms. Not only that, there will also be impairment of the social and occupational function. So some of the symptoms that we see in chronic alcohol includes nausea, vomiting, diarrhea, chronic gastritis, loss of appetite, GI bleeding, tremor, insomnia, memory loss, judgment power becomes impaired, impotency, fatty changes in the liver, heart, and cirrhosis of liver. So these are some of the conditions that we see in chronic alcoholic individual. So the first one is Korsakoff psychosis. So it is a neurological disorder that is due to lack of vitamin B1. And it is characterized by amnesia. Amnesia may be anterograde or retrograde, polyneuropathy, and then confabulation. So confabulation means falsification of the memory. And the next one is delirium tremens. Delirium means there is decreased level of consciousness, and tremens means tremor. So symptoms consist of coarse tremor of tongue, hands, insomnia, restlessness, confusion, disorientation, delirium, hallucination. So hallucination might be auditory or visual. and the person will develop tendency to commit suicide, violent behavior or assault, and damage to the property or himself or to also to other individual. And the next condition is Wernicke encephalopathy. So it is a syndrome that is caused by lesion in the medial thalamic nuclei, mammillary bodies, and periventricular brainstem nuclei. And that is due to the inadequate intake or absorption of vitamin B1. Okay, and the symptoms includes ataxic gait, encephalopathy, and then oculomotor disturbance. So in oculomotor disturbance, we can see papilloedema, unequal size of the pupil, okay, ophthalmoplegia, that means paralysis of eye muscles and nystagmus. And in encephalopathy, there is disturbance of the memory, decreased consciousness level, and then attention deficit. So treatment of chronic alcoholic individual. So the aim is to complete and permanent abstinence of the alcohol, and it should be done by gradually decreasing the dose of the alcohol. Otherwise, the person will develop withdrawal symptoms. And the second one is treatment of psychosis disorder, and the third one is counseling therapy. So these are some of the drugs that is used in chronic alcoholic individual. So the first one is disulfiram, and the dose is 250 mg in single dose should be given, and the dose should be decreased till it reach a daily dose of 0.125 mg to 0.25 mg. And this disulfiram works by inhibiting the step 2 of mechanism of action of ethanol. So that means it will prevent the conversion of acetaldehyde into acetic acid, and this will lead to the increased amount or the level of the acetaldehyde in the body, and this will cause unpleasant symptoms such as nausea, vomiting, flushing of the face, palpitation, etc. So that the person will develop disliking towards alcohol and eventually give up drinking alcohol. So that is how this will work. And the next one is Temposil. So dose is 50 mg should be given once daily, and it also work same as that of disulfiram. And the next one is Cropomazine, 25 to 50 mg. It should be given 4 to 6 hours, and this is mostly used for psychotic disorder symptoms. And the next one is Clonidine. Dose is 60 to 180 mg. It should be given every hour through IV route, and this is mostly used for withdrawal symptoms. Drunkenness. So the definition of the drunkenness. It is a condition that occurs due to excessive intake of alcohol, which causes the person under its influence to lose control of his mental faculty. He or she is unable to perform his or her duties, engage in particular time, and may become source of danger to himself or herself or also to other individual. So the criteria of the drunkenness includes 3 criteria: lose mental faculty, control of his mental faculty, unable to perform his duty, and become source of danger to himself or to other individual. And that occurs due to the excessive intake or drinking of the alcohol. So methyl alcohol. So it is mostly used as a solvent for dyes, paint remover, as an antifreezer, and as an antiseptic. So mostly used for this purpose, and it is not used for consumption purpose. It is cheap and easily available, and it is used for adulteration of the alcoholic beverage. That means to decrease the quality of the ethanol Sometimes ethyl alcohol are used or mixed with the ethanol. Fatal dose is 60 to 200 ml, and the symptoms that we see in this methyl alcohol is totally different from the symptoms that we have seen in the ethyl alcohol. And the symptoms includes severe abdominal cramps or pain, muscle cramp, muscle weakness, metabolic acidosis. So in ABG, arterial blood gas analysis, metabolic acidosis can be seen. And visual disturbance symptoms such as photophobia, blurring of the vision, dilatation of the pupils, total blindness can occur. And the mechanism of action, so it also includes 3 steps. So the first step, methyl alcohol will be converted into formaldehyde in the presence of same alcohol dehydrogenase enzyme. That is the first step. Second, formaldehyde will be converted into formic acid in the presence of aldehyde dehydrogenase enzyme. And the third step, formic acid will enter into the Krebs cycle where it will be dissociated into carbon dioxide and water. And the total blindness symptoms that we see in this methyl alcohol is that is due to the formation of this formic acid. Okay. So ethyl alcohol is the specific antidote of methyl alcohol. And then in case of metabolic acidosis, we should give sodium bicarbonate. And this is the assignment for you.